So picture this. There's a brand new medicine that could literally save your life or the life of someone you love. Now, imagine being told you can't have it. Not because it's not available, not because it doesn't work, but because the system itself just can't figure out how to pay for it. Well, that's not a hypothetical. That's the critical debate happening in Turkey's healthcare system right now. It's this massive tug of war between priceless innovation and the very real price tag of a national budget.
Okay, so here's how we're going to break this all down. First, we'll look at the core dilemma that patients are facing. Then, we'll dig into the current system and why it's holding things back. After that, we'll explore a totally new way of thinking about this. And finally, we'll get into why acting on this isn't just a good idea, it's incredibly urgent.
All right, let's dive right in and get to the heart of the matter. What exactly is this medicine dilemma? It really all boils down to this one simple but incredibly frustrating question. We are living in an age of absolute medical miracles, right? So why does it feel like the newest, most groundbreaking treatments are often just out of reach for the very people who need them the most? And look, this isn't just a feeling or a few isolated stories. It's a cold, hard fact. When you look at the data, there is a massive, measurable gap between the kinds of innovative medicines available across Europe and what's actually accessible here. It's not just a delay. It's like a bridge between science and patients that's dangerously weak. So the big question is, why? Why does this gap even exist? Well, to figure that out, we have to look under the hood at the system we're using right now. A system that, frankly, was designed for a totally different time and is now kind of anchored in the past. The whole system is built around this idea called reference pricing. Basically, it pegs our medicine prices to what a handful of other countries are paying. The goal? Super simple. Keep costs low and predictable for the budget. But this approach, well, it has a really serious unintended side effect. And this is where that metaphor of an anchor just hits perfectly. An anchor is great, right? It provides stability, it keeps your boat from drifting, which is exactly what you want for a national budget. But what happens when you're in a sea of constant, rapid scientific change? Well, that same anchor that gives you stability also keeps you from going anywhere. So that's the trade-off, laid out plain and simple. In exchange for that budget stability, we end up with delays and major availability issues. The system designed to control costs ends up holding back the very progress that patients are desperately waiting for. Okay, so if the current system is an anchor that's just weighing us down, what's the alternative? Well, experts are saying we don't just need a better anchor. We need a completely different tool for navigation. We need a compass. This isn't about just tinkering with the old system. The whole proposal is to reorient our entire approach. Instead of being fixed in place, we need a compass that points us in a fundamentally new direction, a direction towards something called value. Now this, right here, is a profound shift in thinking. The current system, the anchor, it only asks one question. How much is this going to cost? It's all about the price tag. But this new model, the compass, it asks a much deeper, much more important question. Why should we pay for this? The entire focus shifts from just the price to the actual measurable benefit you get in return. This, of course, brings up a super important question. If we're not just chasing the lowest price anymore, what does this word value actually mean when we're talking about healthcare? Because it is way more than just a number on a spreadsheet. The concept of value is really this 360-degree view. I mean, yeah, of course it's about whether a drug works in a lab, clinical effectiveness is key, but it's also about, does this actually improve a patient's quality of life? Does it help them get back to work and contribute to society? And maybe most importantly, what is the patient's own experience? What do they say? This focus on value also changes what we count as proof. Instead of only relying on data from sterile, perfect lab conditions, we start putting a lot more weight on how these treatments actually perform out there in the messy, complicated real world with real people. And ultimately, this is what it all comes down to. This new model puts the patient at the absolute center of everything. Why? Because they're the one living with the illness, they're the one taking the medicine, and they're the one who experiences the outcome. Without their voice, the whole equation is impossible to solve. Now, I want to be really clear. This is not just some theoretical academic debate. There are some hard, cold facts about Turkey's population that make finding a solution to this, well, incredibly urgent. First, just try to get your head around the sheer scale of our current system. It handles over 1.1 billion outpatient visits every single year. That's a billion with a B. That's the staggering weight the system is already carrying, day in and day out. Now, on top of all that pressure, there's a ticking clock. Experts are sounding the alarm that Turkey isn't just aging fast, we're one of the world's fastest and unhealthiest aging countries. That's a perfect storm. That means our future healthcare burden is set to just explode. So what's the roadmap out of this? The consensus among experts is actually pretty direct and clear. We can't wait. The path forward demands collaboration, government, industry, academics, all working together. It demands action, starting pilot programs right now. And it demands innovation to build faster, smarter, and more effective ways to pay for real value. So when you boil it all down, it comes to this one fundamental, game-changing question. Can we make the leap from a system that's always just reacting, always just treating disease after it happens, to one that proactively invests in health and promotes a healthy life for everyone? That is the challenge, and that's the incredible opportunity that's right in front of us.